therapy, PMNCH, and Intro. He has served as in several important committees and task force formed by the different government and international agencies. He is currently serving as a member of National Working Group Pharmacovigilance Program of India, Government of India, member of Indian Pharmacopoeia Commission, Ministry of Health, Government of India, and member of State Committee for Casualty Assessment of AEFI for COVID vaccination, Government of West Bengal. He is the founder coordinator of Drug Information Center on behalf of IPA Bengal branch, and he is publishing a bi-weekly bulletin of Drug Information Bulletin as the editor for more than 14 years. Presently, he is serving as the president of West Bengal chapter of International Society of Pharmacogenomics and executive secretary of Society of Ethnopharmacology, India. So with this introduction, I welcome Dr. Subhashi Mandal. Doctor, you can start your presentation. Doctor? Dr. Mandal, can you hear us? Doctor? Yeah, doctor.
Audible now?
Yes, doctor. You can start your session.
Okay.
Thank you.
So thank you very much for your kind introduction, and I would like to thank to the organizers, especially Dr. Murugan, for inviting me to be a part of this program. Today, I have been told to talk on the topic that is regulatory aspect of the Ayurvedic practice of the plant. But
ये चलेगा ना my audible.
Hello.
Doctor, your voice is breaking.
Am I audible and visible?
Yes, doctor.
My slide is visible now.
Yes, visible, doctor. You can go to the full screen mode down
Okay,
below. Is
okay.
there? You can.
Okay. Is it okay now? Is it okay now? My slide
Yes,
visible?
yes, doctor.
Okay.
You can start. Yeah.
Okay. Well, the topic of my presentation is regulatory aspects of Ayurveda practice for Indian medicinal plants. The topic will cover the subtopic like this: why regulatory mechanism is required, what is the standard as per legislation, pharmacopoeial monograph both for raw materials and finished product approval. It will cover the safety study and the experience or evidence of effectiveness, stability study, suitability for good manufacturing practice, the excipient, general requirements of good manufacturing practice, phytopharmaceutical, and conclusion. The first question is why regulatory mechanism is required. Regulatory policies and regulations are framed to ensure quality, safety, and efficacy of the finished product in the area of drugs, cosmetics, medical devices, nutraceuticals, etc. The main aim to produce quality medicines having safety and efficacy. With this goal, the regulatory mechanism as well as the regulatory provision has been developed. Let us see what is the regulatory status of herbal drugs throughout the globe. In some countries, they consider these herbal medicines as the prescription medicines. In around uh, uh, 50 countries, it is considered as prescription medicine, and in around 98 countries, it is considered over-the-counter medicine, and in around 45 countries, it is considered as dietary supplement, and in around 40 countries, herbal medicines are considered as self-medication only product, and in around uh, 25 countries, there is a separate legislation for herbal medicine, and some other countries considered as health food, functional food, and so on. This is a result from a study conducted by the World Health Organization.
Doctor, the slides are not moving.
It is not moving.
No, not changing. It is still in the first introduction slide.
Okay.
Okay. Okay, doctor. Now it's okay.
Okay. Let us see what is the status of herbal drugs in different countries. Here are some examples like USA, the herbal drugs are considered as a nutritional supplement as well as a drug. In UK, it is considered as a drug. In South Africa, the herbal drugs which are having the place in materia medica with certain health claim as per the MCC norms. MCC means Medical Council Control Council, which is the apex authority in South Africa, and it is considered as drug in Canada, Germany, and China. In Netherlands, the herbal medicines are considered as foodstuff and not considered as a drug, and it does not require any registration under any legislation. Let us find the status of Indian legislation and its standard of different system of medicines as prescribed in the Drugs and Cosmetics Act. The standard of modern medicine is as well as phytopharmaceuticals and homeopathic drugs are prescribed under second schedule of the Drugs and Cosmetics Act. The standard of Ayurvedic, Siddha and Unani drugs, that is ASU drugs, are described under Rule 168 of Drugs and Cosmetics Act. And the point is very important to note that we are talking about herbal drugs and it is a buzzword throughout the globe. But in Indian legislation, there is no such terminology of herbal drugs and no drug uh, is being approved as a herbal drug by our legislation. So this is the standard, and as per the legislation to control the quality, safety, and efficacy, initially they have published the monograph of different raw material as well as the finished product in different pharmacopoeia of different system of medicine. You see, here is a picture of the Ayurvedic pharmacopoeia and the monograph of Ayurvedic drugs is being included in Ayurvedic Pharmacopoeia of India. Similarly, Unani drugs in Unani Pharmacopoeia of India. Similarly, in Siddha Pharmacopoeia of India, Homeopathic Pharmacopoeia, and Indian Pharmacopoeia, and lastly the Herbal Pharmacopoeia. Though this Herbal Pharmacopoeia is there, but it is not approved as per the legislation, but it will help us as a reference book. So let us see what are the different parameters in case of testing of raw plant material. I am showing you only one example of a raw material. What are the different test parameters? So firstly, its identification, thereafter foreign matters, organoleptic characters,
Doctor, your slides are not moving.
Is it visible? The test parameter?
Visible, yeah. Okay.
Is it okay?
Yes, doctor.
Okay. The other parameters of raw material to be tested: volatile oil content, residual solvent, chemical test for secondary metabolites like alkaloid, terpenoid, flavonoid, glycoside, saponin, etc. The testing for TLC or HPLC or HPLC with markers as prescribed by the pharmacopoeia. The test for heavy metal, toxic metal, lead, chromium, mercury, arsenic, and the content of this maximum content of this heavy material allowable, like lead should contain maximum 10 ppm, cadmium 0.3 ppm, mercury 1 ppm, and arsenic 3 ppm. Pesticide residue or organochloride pesticide, organophosphorus pesticide, pyrethroid, the limit of which is prescribed in the ASU pharmacopoeia. Similarly, the microbial content, the limit is also prescribed in the Ayurvedic pharmacopoeia. Test for specific pathogens, aflatoxins, B1, B2, G1, G2 limits are given within the Ayurvedic pharmacopoeia. In case of aflatoxin, B1, it should be less than 2 ppb, and sum of B1, B2, G1, G2 should be less than 5 ppb parts per billion. And the shelf life, I will discuss the shelf life later on in detail. The product approval, before product approval, one applicant should required to submit different data, and the manufacturing should be conducted as in a premises as per the provisions of the Schedule T, that must be hygienic and condition should be hygienic and conducive to the environment. The manufacturing of ASU drugs shall be conducted under the direction and supervision of competent technical staff consisting at least of one person who are adequately qualified. There are guidelines for issue of license with respect to ASU as per the 158B of the drug rules. ASU drugs include all medicines intended for internal or external use for or in the diagnosis, treatment, mitigation, or prevention of disease or disorder in human being or animal and manufactured exclusively in accordance with the formula described in the authoritative books of Ayurveda, Siddha, and Unani, or issue of license to the medicine.
Doctors, sorry to interrupt. Again, your slides are not moving. Maybe you can close this one and again start sharing the new.
Okay.
Close the presentation and again try to share.
This is visible now.
Yes, doctor, it is visible. Just check whether the slides are moving up and down.
Is it visible now?
Slides are visible, doctor, but it is not moving. It is
Okay.
no, not yet.
Okay. Let me continue from here. Well, let us discuss about the stability study. Stability study is being conducted for fixing the expiry date. As per the legislation, each and every Ayurvedic medicine should mention the expiry date of the medicine, and every person applying for the license or renewal of license, they require to submit the stability testing data in support of the expiry date. It is the responsibility of the licensing authority to verify the data submitted by the applicant. The stability study, in case of the stability studies, is being conducted to study the shelf life and factors contributing in stability is the nature of the product, the ingredient of the product, and the packaging material. If on the product level, if there is no mention about any specific storage condition, uh, uh, then it is assumed that the product can be stored at room temperature below 30 degrees. Stability study is being conducted as per the time zone. The entire globe is being, divided into 5 zones, and India is considered within the 5 zones in the zone 4. And for the product which are temperature sensitive to be stored in lower temperature, and the stability study is being conducted at 10 degree more than that of the prescribed temperature. The method of stability study, there are two methods: accelerated stability study and the long-term stability study. The testing frequency in case of formal stability studies should be conducted at at least 3 primary batches. For one-term studies, long-term studies, frequency of testing should be sufficient to establish the stability profile of the drug. For a drug with proposed shelf life of at least 12 months, the frequency of testing at long-term storage condition should normally be every 6 months over first year, and the second year and annually thereafter through the proposed retest period of the shelf life. Is it visible now? Hello?
Not slides are not moving. It is still in the 16th slide only, not moving up.
I am leaving the presentation and again joining.
Yes.
Please allow me to share. Is it visible now? Is it moving?
Slides are visible but not moving.
Still it is not moving.
Not moving. You can try the full screen mode. Go to the slideshow mode.
Yeah, I'm in full slide showing mode. Still it is not moving.
No, the screen is freezed.
So let me try without slide. I'm talking. Will you allow me?
Yes, doctor. You can talk now and later email me the slides.
Okay.
I will share with the students.
Okay.
Yeah.
Sorry, my system is not. Cooperating me.
It's okay. It's okay.
Sorry, audience. It sometimes happens. Sometimes the system is not cooperating the presenter. The storage condition of stability. Let us see what is the storage condition. In case of accelerated stability study, that temperature is 40 plus minus 2 degrees centigrade and relative humidity 75 plus minus 5% relative humidity, and the time span is 6 months. In case of long term, the time span is 12 months. The temperature 30 degree plus minus 2 degree, and relative humidity 60 degree plus minus 5 degree. This is the temperature as well as the relative humidity to be maintained during the accelerated stability testing and the long-term testing. Let us see what is the different requirement under Schedule P, that is the good manufacturing practice. Whenever anybody is going for manufacturing of Ayurveda, Siddha and Unani drugs, they must follow this Schedule P to ensure that raw material to be used in manufacture of medicine must be authentic, of prescribed quality and free from contamination. Manufacturing process is as prescribed to maintain the standard. Adequate quality control measures to be adopted. Drugs released for the cell shall be of acceptable quality. To achieve these objectives listed in the previous slide, to maintain the following conditions stringently. Well-designated factory premises with sufficient space required to be provided, proper machinery is required to be provided, quality control laboratory required to be provided with required instrumentation as well as qualified personnel. Shall evolve methodology and procedure for following the prescribed process of manufacture, which should be properly documented and kept reference for inspection. Here are some examples. What could be the area of a factory of a particular ASU manufacturing unit? Basic installation area must be 12,000 square feet, and in case of producing anjana, only one category, in additional category needs to be provided with, sometimes it is 100 square feet and sometimes it is 200 and 150. In case of anjana, it requires 100 square feet more than additional to the 1200 square feet. In case of churna, it is 200 square feet. In case of capsule, it is 100 square feet. And in case of syrup, 150 and additional 200 square feet. These are some examples. Detail will be available within the drugs and cosmetics rule. Let us see what is the permitted excipient to be used in case of manufacturing of Ayurvedic medicines. There are some excipients like additives, preservative, antioxidant, flavoring agent, chelating agent, etc. The permissible limit is also prescribed under Drugs and Cosmetics Act. And here is some point to be remembered, that only natural coloring agent as permitted FSSAI will be used for ASU drug, and additionally colors permitted under Rule 127 of the Drug and Cosmetics Rule 1945 shall be used for proprietary ASU drug or exceeding any specific limit of usage. Preservative and coloring agents shall be mentioned on the label for the information of the consumer, and the additive details of the additives should be labeled on the label of the product as well as the insert. The good manufacturing practice, there are all pharmaceutical, Ayurvedic manufacturing practitioners, they must follow the guideline of given in the good manufacturing practice as per the drug rules. There are several points that the GMP of Ayurvedic medicine, which is prescribed under Schedule L, are prescribed as follows. The raw material used in the manufacture of drug are authentic, of prescribed quality, and are free from contamination. The manufacturing process is as has been prescribed to maintain the statistics, and their control measures should be adopted. These are different requirements for a factory engaged in manufacturing of Ayush medicine. Its location and surrounding. It should be located in a place which is not nearer to any open drain or open public laboratory. The building should be well constructed as per the requirement. It should provide the area for drying space, area for water supply. Water should be potable in quality. disposable of waste. The manufacturing factory must have their the provisions for disposal of waste from the manufacturing area as well as the quality control area, container cleaning space to be provided. These should be free from any particle and be provided with disposable water. The storage space should be provided for raw material, finished product and packaging material. Adequate working space to be provided. I have already discussed that for working space, the minimum area must be 1200 square feet. In addition to that, more space should be allowed for manufacturing of each category of different oil medicine. The health, clothing and sanitation and hygiene of uh, the workers and the additional forces must be tested for must be tested for contamination of different diseases or is health checkup should be yearly. The premises must have adequate facility for machinery and equipment and the detailed machinery and equipment required for the manufacturing is prescribed under the Schedule P of the Drugs and Cosmetics Rule. Then the manufacturing factory required to maintain the batch manufacturing records, distribution records, records of market complaints, quality control facility should be there with adequate instrumentation as well as personnel. In the case of the manufacturer, those who have no quality control facility, they can get their product tested from a approved laboratory as per the drugs and cosmetics rule. And they should provide adequate facility for sterile manufacturing if they are at all involved in sterile manufacturing. The premises should be facilities for prevention of contamination, both microbial and particle contamination. They should prevent the cross contamination. There must be pressure differential to maintain the cross contamination. Airlock must be provided at the entry. UV lamp should be placed in suitable areas to monitor the microbial load. And in case of sterile manufacturing, the laminar airflow machine should be provided. And now I am coming to another area, that is the phytopharmaceutical drug. This is a separate category apart from Ayurvedic, Unani, and Siddha medicines. Let us try to define the phytopharmaceutical drug, which means a drug of purified and standardized fraction, assessed quality and qualitatively and quantitatively with defined minimum four bioactive or phytochemical compounds of an extract of a medicinal plant or its part for internal or external use on human beings of or animals for diagnosis, treatment, mitigation, or prevention of any disease or disorder, but does not include drug administered through parenteral route. To get the approval for phytopharmaceutical, one manufacturer required to provide conduct the human or clinical pharmacology information. The published scientific report in respect of pharmacological study, including human studies or clinical studies or epidemiological studies relevant for the phytopharmaceutical drug intended to be marketed. Second, where the process and usage are similar or same to the product known in traditional medicine of ethnomedicine. These are the requirement of a document to be submitted to get a pharmaceutical drug test approval. The manufacturer required to provide the clinical trial data, the required to be generated as per Part B of the New Drugs and Clinical Trial Rules 2019, and the clinical data is abbreviated in comparison to the clinical data required for approval of modern medicine. So, uh, 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 let us try to conclude this presentation that India have steady regulatory control over drugs of herbal origin, including Ayurveda, Siddha, Unani, homeopathy, phytopharmaceutical, and modern drug to ensure quality, safety, and efficacy. The manufacturing of Ayurveda drugs should adhere to the provisions of Drug and Cosmetics Act and rules. The loyalty to regulation leads to quality, safe, and efficacious medicine. This presentation is aimed to the uh, prospective entrepreneur, those who want to set up a unit for manufacturing of Ayurveda and Siddha medicine, because these informations are not included in their academic curriculum in most of the cases, but there are some curriculum where it is included. So I would like to open this session for question answer. Now it is open for the question answer session. Now it is handed over to the moderator.
Students, you can ask clarifications. Any clarifications needed, you can ask Dr. Manda.
Any question, please?
Any questions regarding the regulatory aspects of drug? Students? I think no questions, doctor. Yeah.
Good afternoon, sir.
Yeah, once. Yeah. Yes, Rohan.
Sir, can we file a patent for a herbal drug?
Well, my question to this question, my answer to this question is yes, in some cases, but which are pre-existing knowledge as per the documentation of the herbal product as per BIIS system, that could not be done. But if you extract any a separate one chemical entity which does not have pre-existing knowledge as per the documents which are available, you can file patent for this product, but not pre-existing knowledge.
Okay, sir. Thank you.
Any more question, please? Don't be shy. Please ask any question.
I guess no more questions, doctor.
If there is no question, I want to thank to the organizer as well as the students for their listening to my presentation, and I am sorry that this system is not cooperating with me, so I could not present it in a very lucid way. Thank you very much.
It's okay, doctor. Sometimes this happens, technical things. You can share with me to the
Yes,
email.
please.
I will give it to the students. Pass it to the
I'll
students.
send it to you.
Sure. Thank you. Thank you so much, Dr. Mandal.
Thank you. Thank you very much.
Our next guest, Dr. Anamika, will be joining us shortly. Just wait. Uh, Good morning, Dr. Anamika.
Yes, good morning.
Yeah.
Sorry, my computer was taking a while to catch up with maybe yesterday's work. Anyway, and
Thank you.
tired. I hope everybody is fresh and not tired like my computer.
Yeah. Yes, sir.
How many students do we have? Oh, sorry. Give me a moment.
So we have 31 participants now currently. A few of them are having some exams in between, so they couldn't participate today.
Okay, no issue.
Uh,
Exam
so-
is another day.
yeah.
Should we start with the presentation or we are waiting for somebody?
No, doctor, you can start the presentation. I just give you a brief introduction about you. Yeah.
We will learn about each other in a while. Don't worry.
Yeah. Okay, doctor. Then you can start your presentation.
Okay, because we have already lost 2 minutes.
Yeah.
Let us not keep them waiting. Yeah. Okay, so there is a problem here where because this is an Apple computer, it is not giving me rights. Just give me a moment. Let me log in from another computer.
Okay, doctor.
I'm sorry for this.
Okay.
Should I just send the PPT to you in the email that you have sent me so that you can show the presentation, right?
Yes. Yeah.
That will be, I think, easier and
I will be sharing with them later.
yeah. So you can show it also from your computer right now.
Yes, doctor.
Yeah, give me a moment. I somehow could anticipate this, but I'm sorry I did not send you this. Okay, so I have joined from another system, and I will just. I am joining from another computer.
Yes.
Sorry, I am extremely sorry for whatever technical glitch.
Yeah, it's okay. It's okay, doctor.
So let me start with so you I think in professor's session and Chetan sessions, they all know about Srishti and the Honeybee network, isn't it?
Yes, they have learned some.
Yes. So let me start with the thing that we do. This is better. Yeah.
Right. Uh, so Jan was born because we felt that we need to link the innovation, enterprise, and investment. As you know from, I think Professor might have already spoke how Honeybee Network was born in 88, 89, when we realized that farmers, artisans, mechanics, they are not just skillful persons, but they have the knack for doing something new. And we realized that they were filling a gap which was kind of not addressed, was not being addressed by the formal sector, be it institutions, public policy, or market, right? And they were doing small niches. They were doing innovations in small niches where maybe at times they were not scalable, or they did not have like tons of crores of uh, revenue, but they were still uh, making something new, addressing the challenges of the people, and earning their livelihoods in a way. And so 1993, Srishti was constituted to give uh, institutional support to the Honeybee Network. Now, Honeybee Network till now remains an informal network. We just have the logo registered. बाकी Honeybee Network का कोई paper नहीं है, right? So, and somehow we have maintained it because it is like a lot of people who cannot otherwise contribute to the cause because of some reasons or all, they come under the umbrella of Honeybee Network, and we kind of it's a people to people network, so we don't have papers and clauses binding us, right? But slowly it was felt that we will need an institutional structure so that the documentation that we are doing, or the help that we are giving to the innovators, or the lessons that we are learning from the innovators need to be put in a more organized way, you can say. So that whenever, even when we are not there, professor is not there, Chetan is not there, anybody, when we are not there, people will still learn, and they will know what we have learned from the innovators. So in 1993, Srishti was made. And in 1997, we had an international workshop, conference. And it was realized that by then Srishti had already documented about 10,000 or more such innovations from and traditional knowledge from the people. Now, if we keep them into a database and keep them to us, then the purpose is not served. It has to go back to the people. So, as we say that the purpose of Honeybee network, should I admit this? Okay. The purpose of the network is to facilitate cross-pollination, right? So I learned something from you, I pass it on to the other person, and none of us is actually shortchanged or we feel bad about it. One of our innovators, Jena Bhai, long back in another ICCIG has shared that if you have an idea and you share it, both of us have two ideas. We share both of us share two, like one idea each. So you know my idea and I know your idea. But it is not that now I know anything less. But if I have 10 rupees, I give it to you, then I'm losing my 10 rupees, right? But in this case, we are both gaining two ideas. And in like not in commodities, but in knowledge sharing, it should be utmost. And we started developing channels for the diffusion of this knowledge, the innovation that we have got. And another thing that was kind of now very apparent, that not all the innovations could go through a commercial channel, right? So sometimes you make money, but there are technologies which do not give you economic returns, not in the short term, nor in the long term, but they're very good for the maybe environment, for people, for society. So we have to have some channels for social diffusion where the knowledge is being transferred. right? And we have been working for that. Now, when we were linking, so now we have social enterprise, we have commercial enterprise, we have the innovation. Now we need investments. बिना पैसे की तो कोई बात नहीं होती. Now, how do we get the investment? Because GYAN did not have much of a corpus of itself. So, because I was not there in 1997, I was in school still, but this was the work done by our seniors, and they thought that why not link these innovators to different schemes or private investors or even institutions who have facilities. So that's how GYAN started working towards. I will just show you what the golden triangle looks like. Give me a moment, because this is a little. I had changed the PPT in the other computer, but as luck will have it, we did not have it. So let me show. Give me a moment. Okay, and I am giving you the can you see my screen by any chance?
Yes, doctor.
So, if you see our golden triangle, innovation could be formal or informal. It could be technological, institutional, or educational. Sometimes our teachers, especially we have worked, Shrishti, Chetan, they have been spearheading this year, and also Professor Vijay Sarichan from Miami, the Education Innovation Bank. So they document, what they do is they document the practices and innovations of teachers who have gone out of their way to deliver their lessons in a very novel way. And with now the crux is that whatever we do, we try to do it at a very minimal cost, right? Then we have the in enterprise, it can be economic, social, cultural, ecological, right? So enterprise like by definition means whatever involves a risk, and you will do it. So you say he's a very enterprising person, or she's a very enterprising person, right? So it so these are kind of we now for the in the economic terms we take it as businesses, but they can be also social businesses, right? Social enterprise, right? And in connecting them to investment. Now investments can be intellectual, like what you are expecting from all of you, that when you grow up and like you start your professional careers, or even now, you can invest intellectually on the innovators, the grassroots innovators, because they do not know design thinking, they do not have any degrees, they do not know how to draw even AutoCAD, right? Draw things in AutoCAD. So you invest intellectually and you try to help them. They can be investing materially, like sometimes suppose you are making something, you have an industry, and your waste is my raw material, right? This is a very ideal situation where you don't mind just me taking the waste, because anyway you're going to throw it away. It is abundantly or abundantly available, right? And financial, of course. So this is what GYAN does. Now let me go back to the presentation, and I have so many things open. You should not be happy that because this is the last slide. Let me go back to the first one. Now, when we are talking about innovations, At times we feel that innovation have to be like really big, very complicated, something that is like, oh wow, right? But for us, innovations means even small little changes. If I am able to make your life a little better with a very novel approach, maybe a small contraption. If you see the first one, this is a date thinning device. Now, in a lot of in Kutch and the semi-arid regions in Gujarat, date farming is being practiced, and for the dates to grow into a bigger size, they need to thin them out. Otherwise, they'll be small and they will not fetch a good market price. Now, what Narendra Bhai did was just make a small. Now we have a better version of it, but this was the one that he made, and he also got supported from. He got support under the startup scheme of government of Gujarat. Right, it's a very small little thing, and not even the he's not going to use. His laborers will use, right? So workers will use, and it costs about 150 rupees, which is not that costly for the workers as well. And in fact, the orchard owners can have a bank and give it to the workers whenever they work. Right. So then this is Shalini. Shalini who got the APJ Abdul Kalam Ignite. It's now Ignited Minds. Previously, it was Ignite Awards, and the idea was very simple. That when you use walker, you cannot go up or down the stairs because the legs are not adjustable. Now she just gave an idea. The people from NIF, National Innovation Foundation, I think you have met some of our colleagues. They designed it, and she got a patent. She gets royalty. This is Mrs. Santosh Pachar. She developed a carrot variety which is longer, and the ends or the tips do not get forked, so they get better price. Now, if you see that innovations occur maybe in like all the domains, agriculture, utilities, or even plant varieties, right? So when we talk about innovation, the myth around it being very complicated and super sophisticated has to be broken. And all of us have to understand this. Now, this is a very telling slide. It tells the story. Previously, like about 4,000 or 40,000 years ago, we just used very minimalistic design to convey our messages. So here, what we say that now we have come back to emojis, where you make, when you're happy, you make a smiley, and when you're really angry, you make those demons with horns and all, right? So we have been frugal in our communications from time immemorial, right? So it is not a big thing, but we have to realize whenever you are making something new, when you are trying to trying to make a device, we have to understand that at times simplicity is the key for adoption. It has to be adopted as well for your design to be really cost successful. When you are able to impact people, and for impacting people, you will have to uh, make a case for easy adoption, right? So this is one of the summer school groups. They did it for Mahua nut cracking. It needs some refinement, of course, but at least there is a solution where there was none for thousands of years, right? So this Mahua nuts, how they are broken is they are hammered with a stone, and then the shells are broken. And at times your fingers get hurt, and generally women do it. So they made this thing, and we make some of these available to the communities. So the purpose here is to motivate all of you to join the grassroots movement, sense the unmet needs wherever there is like this. It's a forest community where maybe you and I would otherwise not reach, right? So we have to sense the unmet needs of the people and try to help in whatever best possible way we can do. Even at times we say that even if you don't have an innovative idea, but you can sense an unmet need and you understand the problem well, then also half the job is done. This is Dharamveer ji. He is a millennial now. He makes this machine for extracting essential oils, making juices, jams, jellies, shampoos, and whatnot. You know, and I happened when I just joined the network about 14 years ago. He happens to be one of the first innovators whom I met and went to Yamunanagar and documented his story. And you realize that in everything that he does, he has a different approach to the problem. He tries to solve them. And at times, and like now he's well-to-do, he is, as I said, he's a millennial, right? But even when he did not have uh, this kind of resource, he still went out and helped people and made new contraption, new equipment, new machines to wherever he felt that this this work can be mechanized and it will serve people more, he makes it. And last year he also won the HBN Kriya International Awards and for a different set of machines. So he is a serial innovator. Last year, Sundaramji from our network got a Padma Shri, and his technology was very simple. He said that the plants actually do not need water, they need moisture. And we often do not understand that while we are over irrigating, the roots will not develop. Of course, right? When you are given everything, why will you bother to work hard, isn't it? So he has a technology by which he says that in a plantation, the plants and the trees will need only 1 liter of water in their lifetime. And he has made many such plantations and has helped with his work with the ONGC, his work with the forest departments. And the point that I'm trying to arrive at is that sometimes the ideas are simple, but execution matters, right? And here is wood-based crematorium. Now the design and this slide I showed because there are some flaws in the design, and where our engineers or our people help the innovators to refine them and understand that there can be security issues, there can be safety issues, there can be certification issues, or there can be a technology issue, right? So this crematorium is made by Arjun Bhai, and it consumes about like only 25% of the wood otherwise required. So for a body to get burned, as Hindus, we generally cremate the body, right? So it uses, in a normal conventional crematorium, it uses 400 kgs of wood for a body of about 80 kgs. And this crematorium uses only 100 kg and it burns faster, right? Now, Shrishti, I wanted to know from the team if students are allowed to unmute and they can talk.
Yes, doctor, can do it.
So now I have a question for you guys. Tell me, how do I get an investment for this technology?
Students, you can switch on your videos too. Make it as an interactive session.
Any idea? How do I get investment for this? You can also tell if what is the problem with the technology, right? And I will be more interested to know your ideas about attracting investment for such a technology where, I mean, I will not pay to get my body burned, right? In my lifetime, I don't have a return for the sake of it, right? So how do I get, suppose you are my team, you are at GYAN, and I'm telling you that I need to get an investment for this innovator. How will you help GYAN to get an investment? Anybody? nahi bolna? Other students are there, or they have logged in and then they've gone. You can give your answers in the chat if you want. Let me give you a hint. Who will benefit if I get such a crematorium installed in any of the crematoriums around us?
The people who work in the crematorium?
Yes, so they will, but there is, I could tell it off the record, but this is being live streamed. Anyway, so okay, one is the people who are working in the crematorium, then they have to put less of wood, and of course it's less time consuming. You feel the crematoriums will invest in such an year?
Ma'am, second option will be to see the carbon emissions. We are reducing the wood consumption by 1/4. So there will be a significant effect in the carbon emissions.
How
And,
do I sell?
we can talk to the NGOs with them. With their help, we can convince the investors, and more or less the MNCs which are there, they try to show the cover page that they are building a sustainable development. So under that sector, we can ask for the funding.
Under environment, right?
Like multiple MNCs are there.
What happens for MNCs, sort of, that they have, even if they are doing CSR, they are bound by some mandates, right? And at times, it is, though unfortunate, they are extended marketing arms, you can say, right? We have not found any MNC who will be interested in taking this crematorium. Anybody else? Though I feel that internationally it might make a case for carbon credits, and given our population, and in fact, if Arjun Bhai was here, he would have told you all the calculations that he has done. And the first time he came to speak about this crematorium, he said, "Madam, up to 100 kg leke jaogi." So that's the kind of passion our innovators have. The moment he saw me and then said, "Up to 100 kg leke jaogi." So he was calculating everyone's wood requirement while we're still alive. Anyway, or sort of, you go ahead with another, like, who else will be interested, who is nearer, closer to us, who will be interested in saving the wood or saving the environment? Some department which has this mandate.
Ma'am, will the Ministry of Environment of our country be interested in such invention?
Environment and forest, right?
Oh, yes.
The first investor was, of course, the Forest Department, and they decided to put it up in 4 places and see how it works. The second, I think, this was Sneha only when you said about the crematoriums.
Yes, ma'am.
Crematorium people, yeah. So during the last COVID wave, we had written to all the municipal corporations, if they wanted to install this, and the municipal corporation in Gandhinagar, they kind of gave us an order, and it has been installed there, and we're still studying if there are any other. Okay. Now, okay, now sorry, I forgot to tell you about the USP of this crematorium. In electric crematoriums, what happens once the body goes in, you cannot take it out for different rituals, like Kapal Kriya, the skull is broken with a stick. Generally, the Ketan can do it. So many of the people are not very comfortable. Like in the urban setup, it is okay, but in the rural setup, people are not comfortable not doing or foregoing the rituals, part of the rituals, and they are still. So that's why in small towns and cities, electric crematorium has still not picked up, right? Plus, you're consuming power. Here, what happens? You can use any biological material, any bio waste. I mean, it can. He makes kind of dung cakes. He makes small, this barbecue kinds of steak where you have dung and steak and dung. So, and then you can use dry waste like dry leaves and all twigs. So that's how this is kind of a replacement for electric crematorium as well, because the biggest problem was that it could not be opened and the other rituals could not be performed. So you do everything together and then put the body inside the crematorium. So this was just a case where I just wanted to tell you that innovations can be of all kinds, and sometimes you have to really put your head uh, together to think about the possible investors or possible enterprises, right? And now I think Arjun Bhai has been able to deploy, I think, around 8 such crematorium uh, around in and around Gujarat. So let me. Now the technology part where there was a problem, I will show you. I'll get back to the PPT where you'll be able to understand and where students like you can be very helpful. Now, if you see, this was hung with the first very strong rope and then iron chain. Now this was very, it did not look safe. Now it has been made into a sliding one. So this top cover, the bottom one remains stationary and the top cover can be slided across, and it is now safer. And if you see, there is a door where the head side can be opened, and there's also a blower to fasten up the burning. And you can open this and do the rituals. So that's why this is now, I think, going quite well. Though I don't want anybody to use it right now in the lifetime, but anyway, this is something that will come up and we should be prepared. And if we are able to save the environment in some way, we kind of support those technologies. This is another very interesting technology by Paresh Panchal. It's a bamboo splint making machine, and then he had splint, for the agarbattis or the joss sticks that you are that we burn, the incense sticks that we burn. The sticks are made with this help of machine. He has a manual version, he has a fully automatic version, and then he also has a machine to roll up the incense sticks. And this was taken up by, again, for the forest department of Rajasthan, Mr. O.P. Sharma, and it generated livelihood for the tribals. Now, not all the technologies that we do have kind of a social implication. Some are very commercial, but generally grassroots innovators, because they are born out of the need that a community is facing, they have a market. So it's not just an idea. Like generally what happens, we have an idea, we sketch it out, we make the innovation, and then we test it out. But in grassroots innovation, what's happening is there is a need, and people iterate, and they never design it in paper. And though it's a little costlier way to do it, because you make mock-ups every time, and then the final product is coming, and it's very iterative, but they don't give up. So I know innovators who have been working on a single kind of machine for 10 years or a decade, but they still don't give up. They are such passionate people. So what we say that grassroots innovators are often driven by some Vedana. When I see your pain as my pain, I try to do something about it. Like when Arjun Bhai is so moved about the environment, all his family is into saving snakes, doing different saving birds, making feeding platforms for birds and all. So he said that this is another way in which I can save more trees. Now, If you see, these like Arjun Bhai's innovation was not something that will fetch him more returns, or sometimes some of the traditional knowledge holders, they share their knowledge with us, and it just goes in, they know, and we seek permission in the prior informed consent that we share it, and most of them uh, do not have any problem in sharing their knowledge. So they actually are helping us to create our public knowledge and expand the public knowledge domain. And when we are saying about samvedana, है ना, अभी हमने बोला samvedana, सृजनशीलता is of course the innovativeness. Now, this one, like, aren't there times during the day where we also feel moved, passionate, and we really feel bad, but we are not able to convert our feeling into doing. We know, so we will say that we know a lot, maybe this much, then we feel for a smaller group, because we cannot feel for everything or everything that we see, otherwise we go mad, right? And we do very little. But our innovators have been able to convert their feeling and knowledge into doing. Now, doing also means perception about things that, like, suppose we are thinking of the same problem, but we are thinking in two different directions, right? Now, if you see, these two technologies are similar. So we have a vehicle which runs on the road, and also because the person has to go maybe cross a lake or some water body, it has to be a boat also. While the first one is a relatively cheaper version, the second one, which was developed in India, is a relatively costlier one. We are turning a car into a boat. It is a little costlier than turning a boat into a automobile, right? So this is the, like, because we are now 30, I think 31 people here, all of us will not maybe think about similar solutions, but that's so be it. It's okay. I mean, we still need to try. We also, while we are working on our ideas, we also need to be aware of oddities which are there around us. Spot them, connect them to people, because I feel that all of us want to feel good at the end of the day. हमें ऐसा लगना चाहिए कि we did something good, right? And people have there's, I think there will not be any exception to this rule that all of us want to be good. And when we are able to help somebody, nothing like that. So we have to look for the odd one, like the star, which is looking at the opposite side while everybody else has chosen to look the other way, right? Now, how it has now ingrained in our system is that wherever we go, we find innovations. And all of you can become honeybees for all your life, right? So this was Nasirji, whom I had noticed in Tehran. So I was there for a diplomatic meeting in Iran, and we were around the bazaar there. Tazris Bazaar is the name. And I found, and I said that people sell bhuttas here also, but this looked very different, right? हमारे यहाँ तो open इसमें करते, which is not very efficient, and this bhutta tasted something different also because it is baked along with the covers, right? So, and it was efficient. But it was, now when we look for a technology, or we are looking at a technology, it may not be as good, right? But and if we ignore it, if we don't take any interest, then we will not know about it. Now, there is another, because you all are now science students, let me ask you another question. These are two kinds of burner. This is something that I saw in Quito, in Ecuador. This one is a spiral one, and this one is somewhat like we have it here. Why do you have a burner with a spiral jet for a hose for the fuel to go out? We will, I think, conclude in 5-7 minutes. Now tell me, I want to know from you. Don't look up at Google, because this is something that we call them the mechanics of, or the kabadiwalas have done there. They've repurposed the stove, and they found that it is better in certain kind of cuisine, and they made the holes in a spiral one. And this was in a junkyard, एक जगह थी कीटो में जहाँ पे सेकेंड हैंड चीजें मिलती है, तो वहां पे हम लोग गए थे. Anybody?
Ma'am, using spiral, I think it will increase the area of combustion, which will increase the area for heat transfer. So it will be efficient cooking or efficient heat transfer.
Yes, partly. Anybody else? I have heard Saurav and Sneha, but I guess all of you have some idea. आप बता सकते हैं? रोहन, जसलीन. Anybody? So what happens in South American cuisine or in Chinese cuisine, sometimes in India also, you need a very high temperature while you're cooking certain dishes, right? Like when you eat the chow mein, I think roadside mein sabne dekha hai. And it also needs a bigger surface area, how Saurav said, for the yolk to be moved and tossed, the materials to be tossed, right? And this was not made by any of the bigger brands there, right? जैसे हमारे यहाँ पे भी ऐसा वो prestige वगैरह तो शायद नहीं बनाएंगे, right? So the local people realized it and they made it. So there will be, if you also look around, I think you will find people who have made something or customized something according to their need. And now this has a very big market there. So I will just have a couple of slides more. When you design, Chetan has worked extensively on this. This was sati that was previously made, because the bullocks were, people were not keeping bullocks anymore, and while the agricultural tasks had to be still done. So Mansukh Bhai Jagani, he attached this contraption of Umbrelli. So Mansukh Bhai Jagani is from Umbrelli, and with the old bullet, and now it has different versions of it according to the crops, according to the soil, right? And the cost also. Now what Mansukh Bhai did, though he has a patent even in the US, right? But he did not contest it within Gujarat or in the country, because farmers or artisans or mechanics were doing it. So we say people to people copying is allowed and encouraged, but people to MNCs or bigger corporates, it is under licensing. Okay, so your design has to lend it to the needs of the other people, so that more and more people can customize it. देखो, एक जमाना था when ready-mades were really the talk of the day. It was coming up. Now again, if you see these personal boutiques and customized clothes that you're getting, semi-staged clothes that you're getting, is again picking up, because not all size. Previously, what happened? The human body type was segregated into 6 different sizes. Then this was when the industries took over and we have ready-made garments and all. Then we realized that these body sizes are actually not same across different ethnicities, different peoples of people of different origins. Like the European system is different, American system is different, and what we use in Southeast Asia and in India is different, right? So now, how do we make a design which can be adapted to the need of the people? So we call it auto process. It's a term that has been borrowed from the biological sciences. I think most of you are familiar, and you know that it is the ability to self-organize or change in the face of a stimulus, right? Now, this is where we have many more things to say. This is where we feel I should make a point that grassroots innovations are not जुगाड़. तो आप लोग कभी भी grassroots innovations को please जुगाड़ मत कहिए. अभी क्या हुआ, ये Western इसमें with this जुगाड़ thing very popular, we have started calling ourselves as जुगाड़ीज and our innovations as जुगाड़s. No, some maybe कभी कभार क्विक फिक्स हम लोग करते हैं, ऐसा नहीं हम लोग नहीं करते हैं. और ये ऐसा नहीं है कि सिर्फ इंडियन सोसाइटी करती है, बहुत लोग करते हैं. जैसे हम लोग ताले को कभी हथौड़ी बना देते हैं, तो कभी अखरोट फोड़ने की कोशिश करते हैं, है ना, दरवाजे से. but the doors are not made for cracking walnuts, right? So I don't deny that we have certain practices where we do jugaad, but grassroots innovators जुगाड़ वाली इसमें किताब में मनसुख भाई प्रजापति है, इनका भी जिक्र है. If you see his machines that he has made, they are not jugaad. They are customized according to the needs, according to the products that he makes. See, such big heavy machines. Even the kilns he has designed. We don't have circular kilns anywhere, like just like that. Right, he has made it where he bakes the diyas, right? So this is something that is not acceptable. This is another innovation from Saurashtra. It is a mobile threshing machine. The problem was, like, where we could help as an intermediary organization was when we first received, let's see if you see, it was, the chassis was cut. It could not be certified. It could not be registered, because when you kind of amend the existing chassis, you have to register it as a different farm equipment, different automobile, right? But what our Zubair from our team what he suggested is that it could be made in this cloud, right, part of the tractor, right? And the innovation was not in the tractor, not in the threshing machine, but on the conveyor belt. This is something I will show what happened next. So now this whole thing has become an attachment to the tractor. Now the certification process is little less cumbersome. It takes less time. Now these are small little changes that we have to suggest as a formal sector. What do you say? Engineer or professionals, where the innovations otherwise will take a longer route to get certified. If they do not or tested, if they do not get tested, they will not be certified. If they do not get certification, they will not get access to any of the financial market, financial tools that are available no subsidies, no loans, because they are illegal, and you have to legitimize, right? So that is how that is another role that GAN does. And we also work with children. And this is the fun section because we are ending. Let us end this session with a lot of smiles. Now you cannot like you are now, you switch off your videos and I cannot see what you are doing in a conventional classroom. This is a child from Surat. What she did, she said whenever the teacher turns around and we start playing, now how will the teacher look at us? Put a mirror in front and the teacher will be able to see who is doing what, right? This is so if there is an accident on the road, there will be the traffic signal will tell you that there's an accident to or like go there or help in managing the traffic. And this is a very simple. This was Advay from Noida, and what he did is that like we have is was standard 4 student, right? That like we have dustbins, why can't we have the similar mechanism on policy so that we don't have to touch it whenever we use it, right? So there are many such examples, and I will also say that grassroots innovations are different from innovations for grassroots, but we support both of them. If you have an idea which is which can go to the grassroots, help the people, do share it with us. We'll try to help you. And if you have an innovation, do apply for the HBN Kriya International Awards, HBN3R at the Crematorium. And you can mail it to us here, and I will also send the form link to Shrishti, and they will circulate amongst you. Whoever have an innovation, you can, because it's last year we had 2,500 entries from 87 countries, and the winners were from 8 countries. So you can participate in that, share your innovations in that, and I'll share the link. If you have any question, we can open it and we can conclude. Thank you.
Thank you, Doctor. Students, if you have any clarifications or questions, you can ask Dr. Anamika.
No questions? थक गए, सबको भूख लग गई.
You can also share your questions in the chat box also if you are feeling shy.
Or you can write to me later as well. This is my email ID. Or you can drop your questions to Shrishti team. They will send it to me. I think people are now waiting for the lunch.
Yes. That was Saturday too.
Yeah. But anyway, it's good always to interact with students, and I hope that you, some of you will be joining hands with the grassroots innovators and take their technology forward. Thank you.
Thank you. Thank you so much, Doctor. Students, after 5 to 10 minutes, we'll be sharing you the quiz questions to your WhatsApp. It will be in the Google Forms. You are requested to fill the forms and send it within 10 minutes. Okay. After 10 minutes, the link will be expired. You cannot send. Okay. So we'll share with you. Just make sure you fill your forms and submit it immediately. Okay.
Excuse me, sir. Can you please
Yes,
repeat what you said? Because your voice became distorted in between.
So after 10 minutes, we'll be sharing you the quiz questions for this week. Okay. So you can answer it and fill the answers and send us back in 10 to 15 minutes. We'll give you the time also along with the questions. You have to submit it within the time. Okay. So
Okay,
how many of you have submitted your assignments? How many of you have worked on assignments?
Sir, we have work. Tomorrow morning is the assignment time. We'll be sending by today evening.
Okay.
So I have sent my assignment.
Okay. Thank you, Harish. Thank you. Then we will be sending you the quiz questions. Please be ready. Okay. Thank you for today.